Clinical Pharmacology: The Object and Purpose, Pharmacodynamics and Pharmacokinetics. Introduction to Clinical Pharmacology. The second half of 20th century saw a rapid increase in development of new medications, leading to a growing need for specialists. In clinical pharmacology focuses on studying how drugs interact with the human body and aims to ensure their safety and effective use in today's world. Modern trends like personalized medicine and advanced clinic trials are transforming this field. How do you think personalized medicine can help treat common conditions like high blood pressure and diabetes? In high blood pressure management, personalized medicine uses pharmacogenomics to identify how a patient's genes affect their response to specific drugs. For example, genetic testing can reveal if patient has variations in the CYP2D6 gene, which is responsible for metabolizing beta blockers. If patient is a slow metabolizer or lower, those are a different medication like an ACE inhibitor may be more effective in reduced side effects. Similarly, patients with variations in AGT or AG1 gene might respond better to angiotensin receptor blockers instead of ACE inhibitors. In diabetes, pharmacogenomics can determine how a patient responds to an oral medication, like metformin. For instance, variations in the SLC22A1 gene can affect how metformin is transported in the body. Patients with certain genetic variant may require a higher dose or a switch to another drug like Sulan UACE or DPP-4 inhibitors to better control their blood sugar. Additionally, genetic testing can predict the risk of metformin associated side effects such as gastrointestinal issues, helping with doctors make more informed treatment decisions by using a patient's genetic profile. Doctors can select the most effective medication from the start, avoiding the trial and error approach and improving the patient's overall treatment outcome. Statistics on drug side effects in the United States. Adverse drug reactions, a leading cause of hospitalizations. Recent data shows that 10 to 15% of hospitalized patients experience adverse drug reactions, costing over $136 billion annually. Modern pharmacovigilance systems monitor these reactions and help prevent serious consequences. The modern drug therapy today can be as complex as potentially risky as surgery. With thousands of medications available, managing their interactions requires expertise. Managing multiple medications, especially in older patients or those with chronic diseases, is crucial for avoiding harmful interactions. For example, taking multiple medications like metformin for diabetes and lansoprazole for hypertension can lead to several challenges. Drug interactions, for example, beta blockers, example atino used for hypertension, can mask symptoms of hypoglycemia, making it harder for diabetic patients to detect low sugar levels. Side effects overlap. Both metformin and ACE inhibitors like Lenoi can cause fatigue, making it hard to identify which drug is causing these symptoms. Adherence issues, managing multiple drugs with different dosing schedules. Insulin injections plus amlodipine for blood pressure can confuse patients and reduce adherence, leading to poor control of both conditions. These challenges highlight the importance of careful management and monitoring when combining medications for conditions like diabetes and hypertension. Definition of clinical pharmacology. Clinical pharmacology is the science of studying drugs in humans with the primary goal of ensuring safe and effective use. Key aspects of modern clinical pharmacology include personalized treatment based on patients' genetic profile and genomic medicine. Practical example, use an example of patient receiving a medication that is tailored to their genetic profile. For instance, how pharmacogenomics might influence a doctor's choice for blood thinner. Example scenario, a patient with atrial fibrillation is at risk of stroke and needs to be placed on anticoagulant to reduce The risk of clot formation the doctor initially considers warfarin, but before starting therapy, the patient undergoes pharmacogenomic testing to determine their genetic profile. Pharmacogenomic considerations CYP P2C9 gene. This gene influence how the liver metabolized. Wherein if the patient has a genetic variations in this gene, they might metabolize warfarin more slowly, increasing the risk of bleeding because the drug stays in their system longer at a higher concentration. Another gene that is called VKRC1. This gene is responsible for vitamin K recycling in the liver. The variants of this gene can determine how sensitive is the patient.